Good afternoon. Has everybody got their lunch, ready to sit down, relax a little bit? Okay. My name is Kathy Weatherly. I'm an occupational therapist. I also am a CLT LANA, which means I'm a certified lymphedema therapist and have sat for the Lymphology Association of North America exam. On top of that, I am the CEO of a company called Solaris, and I'm a manufacturer of medical devices for the field of lymphedema and venous edema. So I want to disclose that to you right away. What we are going to talk about today is lymphedema awareness after breast cancer. This is a program that we offer therapists copies of the program that you're going to see and brochures, and we reach out to the therapists so they can go out into their community and train women who are at risk, go to their breast cancer centers, stuff like that. My associate standing on, go stand up now, is Paul Sacconi. He's what you call bringing the younger kid along to run the computer. Okay? And we had problems earlier this week, and I said, what? I should have brought an 11-year-old with me? So we will go with the guy in the 20s, right? Okay, so let's start this, and remember the format of this particular lecture that they asked me to put together was to talk, my audience was to be therapists, nurses, people who were going out into the community and going to train consumers, patients who are at risk of lymphedema. So the first 3 slides are not going to make much sense to you, but we're going to go through them anyway. When you are talking to someone in the community, you want to keep in mind that there are core teaching principles that you have to keep so that people remember what you've said. Of those core principles, we're talking about repeating them at least 3 times or demonstrating them a total of 3 times. You need to vary your learning style to include visual, tactile, interactive, and lecture formats. So even though I'm up here on this podium, I'm going to get down off of it, if he helps me. Make eye contact with the entire audience. You will see I have a real deficit going to the right. I don't know what it is. I always tend to go to the right, I avoid the left. And I don't know why. I've taken all these speech classes, all those things, and I still can't quite turn my head that way. The other thing is to relax, have fun, move around. Being on a podium makes it a lot harder. But when you're talking to someone in the community, if you're talking to women at a support group meeting for breast cancer, if you are in a hospital setting in which you're a nurse and you're going room to room and you're educating someone and you're talking to them, the more stressed out you are, the more stressed out they are. And so the message gets mixed. And instead of them being able to take in the information and really feel comfortable that they know it, your stress makes them feel as though there's something scary about what is being told. So we'll move on. The purpose of a lymphedema program and to have a breast cancer awareness with lymphedema program is to help your community and make sure that the people in the community are aware of it. There is nothing worse than someone who comes in and all of a sudden has a swollen arm and they say, nobody ever warned me about this. We need to reach out to our friends, to our coworkers, to our departments, to the person who sells garments. The people who are out there need to have basic information so people are aware of lymphedema. The other thing that people forget to do is do in-services with your personnel, your coworkers in a hospital. I cannot tell you how many therapists I know that are treating lymphedema and they never thought to go to the oncology department and say, hey, you guys want to have lunch? I'll come in and do a little lymphedema awareness with you. They have a women's health center or a breast cancer center, but they've never offered to come in and do just a small presentation with them. you want every single department to know about lymphedema because it does affect them. It affects the phlebologists that are taking draws, blood pressure. You know, it's important that the whole team learns this information. Marketing opportunities. We are in a competitive environment in which our hospitals and medical groups are competing for patients. So part of doing this outreach is letting people know that you as a therapist have a special skill set and that you are there and you are available. I have seen people who are traveling for an hour or two away from their home when they had a therapist in their backyard. It's very, very important to let the community know and to build your hospital. So we already went over those things. Free marketing material. Whether you are a patient or you are a medical service provider, companies like mine, Juzo, Jobst, Medi, you see it all over the place, have free literature that all you have to do is call them and send me some pamphlets. Juzo has a beautiful one on lymphedema. It's a very, very good one. There are others that are good on breast cancer, different types of things, but use the free resources that you can get. We have a lymphedema awareness brochure. We have posters. We make them so that they're not marketing our product. We are not selling our product in these, but there is space for you to put your labels so that you are talking to someone and they know who gave them that brochure. Go ahead, Paul. Build business relationships. We talked a little bit about DMEs. Does everybody know what a DME is? In this area, Paul, they are called...
Durable Medical, or...
No, what's the names of them, though?
Oh, to our Keen Medical.
Keen Medical Store, places where you go in and you buy crutches, stuff like that. Those are the places that are going to fit someone for a compression garment. Sometimes those people, they are trained a lot by the manufacturers. We are not always the best trainers because sometimes we're biased. So letting them come to an in-service is a good way of making sure that they know what your therapy program is like, not what a manufacturer said should be the therapy program. Go ahead, Paul. So this is the actual presentation that we've used. Those of you, again, in community health or that want this, you will be able to leave your name and your email, and we will send this to you electronically. You can also ask for the brochures or other information that we have, like the posters that we have handed out. So this is what I would do in a community setting, so everyone here who is someone who's potentially at risk. The first thing you need to talk about is what is the lymphatic system. Of the people here who are consumers, raise your hand if somebody went over with you, how does the lymphatic system work, what is it? Most of you, did anybody not have anyone explain this to them? Okay, so part of the circulatory system that we are all aware of is the arterial system and the venous system. Arterial brings the nutrients, oxygen that is necessary for every cell in your body. The venous system returns the circulated fluids. It does not return larger items than that. There are a few vitamins that it can return back. What happens is we have a lymphatic system that runs parallel with the venous system, and its job is to pick up the larger waste particles. So you hear about cells, dying off and new cells being reproduced. Well, how does the dead cell get out of your body? It goes out through your lymphatic system. If you have cancer cells free floating in your body, they're going to be picked up by the lymphatic system because it's the only one that has a large enough vessel to pick up a cancer cell and take it out of the body. We're going to see a video where you can see this lymphatic system in action, and we are hoping it works. This is where I need the 11-year-old. Do it. Nope. Can we go one more slide and come back? Okay. So this is out of the University of Flinders, Australia. You're seeing them go into the tissue. We're going to look closely at the skin, the hair, underneath the skin. You're going to see what we call the interstitial space. These are the lymphatic vessels. This is the initial lymphatic. You've heard about collagen. When your skin gets pulled, it opens up. The plasma proteins, the bacteria get sucked in. They get propelled by a tiny little muscle in this lymphatic system. You see it pumping? And it keeps moving it towards your heart. All that little hairy stuff is collagen fibers. When it's inside, it is a negative pressure state. Fluid outside is a positive. So if it opens, fluid rushes into it. We just are coming up on a lymph node now. So the fluid's going to go up to the lymph node where it gets filtrated. So let's go back, Paul 1. This is the lymphatic anatomy. You have this chart in front of you. If you pick up a textbook and you look up lymphedema or lymphatics, you are not going to see this chart. How this chart was developed is we went to a medical group and we did a collection of resource looking for studies on the collateral lymphatic system. All lymphedema therapists are taught about this, but there's no pictures of it. So we went to the Netter group and said to them, if we provide you the research, will you double check our research through your doctors, and then we would like to create a poster that shows the collateral lymphatic system. So the anatomy of this, if you look at it, this is going to tell you the ones that are your primary lymphatic system. Further down on the poster, you're going to see definitions for where these collaterals are. So the body is built so that the fluid should all be going to the axillary node. But there are known pathways that they have proven exist that you can change this fluid structure to make it move to the other lymph node. There is an extra little vessel that exists on the front of the arm that is known, and 20% of people have this, and it's a backup system. So when your therapist is talking about doing MLD on you, she is going to be taking a look at, you had lymph nodes removed in the axillary. She's going to know the pathways, and on your poster you see them in the back as well as on the front. And she's going to try and direct that lymph fluid to a place that is working. Go ahead. The lymph fluid itself moves by that skin movement. In that one picture you saw, those little collagen, and you pull. So when you stretch your skin, it opens up the initial lymphatics and the fluid moves in. You saw the small muscles in the lymphatic collectors. You saw the muscle contractions inside there. But on top of that, there are muscle contractions, the muscles in your arm, the muscles in your legs, the muscles in your back. Our skin serves as a protective barrier, but also it has resistance, not to let the stuff move around, to stop fluid from building up in it. When the muscle contracts, it pushes against the skin, and it kind of causes a spurt of fluid, venous fluid and lymphatic fluid, to move towards the heart. So you want to be moving. Joint movement, the lymph nodes are always located where there is a joint. So they're at the elbow, base of the neck, armpit, top of the legs, behind the knees. When you move, you put higher pressure on those lymph nodes, and you help, when you're bringing your arms in, you help smush them so the fluid moves fluid through it and keeps propelling it towards the heart. Breathing, diaphragmatic breathing, also functions, again, up and down pressure. These lymph nodes run along the spine. That movement of breathing is also pushing along those nodes and moving the fluid towards the heart. Go ahead, Paul. The lymphatic system function is that it drains and returns interstitial fluid in the blood. What's the best way to do this? Let me see. If you think about your skin inside it as actually having fluid in there, that's sitting in there. Paul, you want to do it again? So you can see the fluid. Maybe if I get closer. This fluid is moving from the arterial system to the venous. Do you see these little guys moving? This is the bacteria being absorbed by the lymphatic system. So in the very little bits of your skin, that fluid moves across. The water goes to the vein. The proteins, the bacteria, go to the lymphatic system. This is keeping it, if it didn't happen, what would happen is you would get infections. And that's part of the problem with lymphedema, is that the fluid doesn't move, and so it becomes stagnant like a swamp. So we want that fluid exchange moving as it goes. And I've obviously told you that it filters the damaged cells, cellular debris, and excess plasma proteins out of the body. So we can go on. What is lymphedema? This is according to the American Cancer Society. What they say is lymphedema is a buildup of lymph fluid in the fatty tissues just under the skin. This buildup causes swelling or edema, most often in the arms or legs. Lymphedema can result from surgery or radiation therapy to treat certain cancers. When you are being treated for cancer, they are going to remove lymph nodes to stage your cancer, to know what they're dealing with. They're going to come back and say you're stage 1, stage 2, stage 3. They're also going to tell you if the cancer has metastasized, which means it's actually gone through the lymph nodes and been recirculated in your body and not killed by your body. When you read this, and when I'm talking to you about this, it assumes that there's only one lymphatic system. They remove that node, you're in trouble. I hear people say to me, I had 7 lymph nodes removed, and I have lymphedema. My friend had 25, and she doesn't have lymphedema. Why does this happen? It's a legitimate question, and there are lots of reasons. Did you have, chemo? Did you have radiation? There's lots of confounding issues to deal with. But the other fact is were you just naturally born with a good backup system? So what Professor LeDuc says is that another way of assimilating this information of what is lymphedema is to think about it as it's a failure of the collateral system, that part that's green, purple, and all that on that chart, to react to an impairment of the primary lymphatic system. You just were born with fewer lymphatics. You don't have all these little backup systems. When you look at the collateral pathways and you look at the numbers, some of them 56% of the people have, others 20% have. There are some that 80% have. But it's all just by your own genetic makeup as to whether or not you have a good collateral system. Go ahead, Paul. What causes lymphedema? They did talk about surgery. They did talk about cancer. But they also forgot infections. There are a lot of people who made it through the breast cancer treatment and they had no lymphedema. And 3 years later, they were digging in their yard and they got a cut, and through the cut came bacteria that was in the ground, or they got cut with an old tool, and the bacteria got in, overwhelmed the lymphatic system, and it is what caused the rest of the nodes to be affected and burnt out those nodes. So an infection can kill a lymph node. An infection can damage the lymphatic system. So when we talk about awareness, you need to be aware that, wait a minute, an infection later on can be a big issue. Trauma. I am a person who had a traumatic injury on my arm when I was 8 years old. I had a near amputation of my arm. It's cut from here to here. It broke the bone. It cut the muscles. They put me back together again. Fortunately, I was very lucky. I have no sensation in my fingers for hot and cold. I definitely have lymphedema in my arm. Do you know that I treated lymphedema for a full year? And I would teach internationally about hand therapy. And I would say to the PTs and the OTs that are in the room, look at my arms. What is this? I was treating lymphedema. What is this? I would say to my doctors, you know, sometimes my arm feels really funny. It's too big. I went through training and we focused so much on breast cancer that I didn't even think about the trauma to my arm. So there will be people that you will meet in your life that have had a severe injury like mine, had a crush injury, whatever, who if you see them starting to swell, it could be lymphedema. That can also do it to them. Parasites, yeah, we don't have to worry about in the U.S. India and some other countries do. They actually have the mosquito bites infect the lymph nodes with worms. But we don't deal with that, okay? Once again, we don't deal with it unless they bring one of those mosquitoes over. Primary lymphedema, which the American Cancer Society didn't address at all, is a genetic predisposition. I had lots of patients who were women who turned 35 and all of a sudden they started having swelling in both their legs. And the doctor never thought of it as lymphedema, it's just that's the way your family is. Well, there is a trigger around 35 with hormone changes that women do develop lymphedema in their legs. Who knew it? There are children born who have a genetic problem that creates lymphedema from birth. There are also children who are born with just an abnormal development. It doesn't have to do anything with their DNA. It's just some people get dimples, other people get other little problems. Everybody know that a dimple is a retarded face muscle? That's what it is. Next time you see someone with a dimple and you think it's cute, remember it's a retarded face muscle. Okay? What's one person's defect is another person's cute little charming thing. And I didn't get any of them, so I'm jealous. So with lymphedema, there are risk factors that we want to look at. If you want to see something really, really scary, spend 2 nights looking up lymphedema on the internet. There are people who are going to scare you to death. And then you think, I'm going to be brilliant, and I'm only going to read the ones from Mayo Clinic, research centers, ones that have been published in what looks like medical magazines. Well, let's take a look at what the experts say. So, this guy is telling us, it was a guy, wasn't it, Paul? How do you pronounce that name? Myskowski?
Sure.
Okay. Said that if you take, he did a whole study on a bunch of women, and he looked at the women who had lymphedema and the women who did not develop lymphedema by 3 years. And then he looked at their age, and he found out that women who developed lymphedema were, on average, remember, everybody's numbers pooled together, it averaged 56.2 years. But the people with no lymphedema were 59.4. His conclusion was, older women don't get lymphedema at the same rate as younger women. You're talking 2 years, 10 months difference. And how do we know that that one group didn't have a 18-year-old thrown in there? You know, when everybody else had a 29-year-old that skewed the numbers. This is actual research. Toganda. He did it differently. He took a real look at the age and said, that other guy, he didn't know what he was doing. So he said when he took a look at his people, and it was 1,400, wasn't it, Paul? 1,400 women. He looked at the number, the percentage of people who got lymphedema, and he broke it down by age. He also came back and said, geez, if you're 60 and older, your chance of getting lymphedema is significantly reduced to someone who is 35 to 44 years. And he blamed it on age. Now, it doesn't have anything to do with maybe the more aggressive cancers or when you're younger, and maybe these ladies had more radiation or more chemotherapy, or maybe they had to have more surgery. He didn't look at that at all. He only looked at age. And if you looked at this alone, you would say, I'm 62. I have a 20% chance of getting lymphedema. Cool. Go on, Paul. So Clark, he looked at it as only you're either over 60 or you're under 60. That's it. We're divided into two groups. If you look at his numbers for lymphedema at 3 years, the women who were over 60 is 24.3%. The women who are under 60 are 16.5. Go back 2 slides. This guy says, the older that you are, if you're younger, you won't get lymphedema as much as someone who's younger. The next one, Paul. This one, the older you are, the less likely you are to get lymphedema. Next one. The older you are, the more likely you are to get lymphedema. These are all published, peer-reviewed studies. You think you can't find something that's telling you what's going on. It's like bacon. Sometimes it's good for you, sometimes it's bad for you. You just know the day that you eat it, it's when they have it in the newspaper that says it's a carcinogenic and you should never eat bacon again. Right? Eggs are the same way. Paul and I debated this morning on our eggs. It's a big deal when I go shopping with my husband at how free he wants his chickens to be. Does he want the chicken out of the cage, in the building loose, or does he want him free range? And how much is it worth to him? So it all changes. Sentinel node biopsy. I hear a lot of people talk about the difference between sentinel node and an axillary dissection. We're going to look at this and see, well, does it hold true or not hold true? So on this particular study, you see how they write them so funny? They don't even add up to be the right numbers. You know, if you look at it, do you really have 100? So if you had a sentinel node biopsy done, and you said yes, you did, the percentage that developed lymphedema was 69.2. That's what it says. And the percentage that did not develop lymphedema is 80.9. We went back and double-checked this. Our numbers aren't screwed up. That's exactly the way it was published. It doesn't add up correctly. The only way you get 100 is ordering the top number and the bottom number. It doesn't work with this. So there's no way to take any sense out of this one whatsoever. This one was only looking at axillary lymph node dissection. Did you have it? 69.3% did develop lymphedema. 39.3% did not. Okay? The other one is no, you didn't have axillary lymph node dissection. 30% chance of developing lymphedema as opposed to no lymphedema, 60.7. That sounds pretty good, right? Except, what are they saying no to? Did they say, well, I didn't have an axillary lymph node dissection, but I did have radiation and I did have a sentinel node biopsy? Or are these people who only had lumpectomies? We don't know what we're dealing with. There is, in the article, absolutely no statement as to what is the answer to no. Paul? Lymph nodes removed. I actually like this one. I think this one makes a lot of sense. He is saying if no lymph nodes are excised, it's 6.3%. When I was looking at that, I thought it said 63%. It was like, whoa. If no lymph nodes are removed, you have a 6.3%. If 1 to 9, it's 19.8. If 10 or more nodes are removed, 41.3%. We don't know if any of these were sentinel node or not sentinel node. But it does say if you've had no lymph nodes removed, you have a 6.3%. Could that be because they had radiation or chemotherapy? Could it be that the lymphedema was in the breast, not in the arm? We don't get that information. So, Paul? Axillary node status, whether it was positive for cancer or negative for cancer. Lymphedema at 3 years, it was positive 26.2%. If your axillary node status at 3 years, or was when they did it, 3 years later, 17.9. 73.8 of the people who did have a positive node had not developed lymphedema in 3 years. Go on. This one is BMI. That's a big one. BMI is being, a lot of people are saying, if you're overweight, you are going to have a greater risk of having lymphedema. This study shows that the people who had lymphedema on average had a BMI of 28.2. 26 and above is obese on a BMI. But the people who didn't have lymphedema had a BMI of 26.1 on average. So this is saying obese and a little more obese. That's the difference between if you got lymphedema or you did not get lymphedema. It's very screwy. You're giving me that look, but that's what I look like too. Go on, Paul. This one is Tagawanda again. So this is 1,400 people. And he looked at the BMI range. And then he came up with the percentage of people within his 1,400 that had developed lymphedema. So if it's minus 25, you're not obese, you're not overweight, your chances of getting lymphedema was 22.9%. If you run into the lower levels of obese, 30.5, and if you're 30 BMI or higher, 37.9. This looks very, very much like it's proving that if the more weight you have on, the more chance you have lymphedema. And this would be, if research continues to hold, something that you can control. If this holds true as time goes on, and this is a relatively new one, 2014, and that's what they're basing this on, if you lose 10 pounds, you are lowering your risk of having lymphedema, and it's something you can do something about. You can't put back nodes. You can't change whether you had radiation or chemotherapy. Let's go on, Paul. Clark came back and he said, if it's more than 26, your BMI, that at 3 years, 28.3% of the people had developed lymphedema. And if your BMI is between 19 and 26, only 14% had developed lymphedema by 3 years. This one is also substantiating that weight is a factor into whether or not you develop lymphedema. Go on, Paul. In your packet or in your information that you received, you have a risk assessment questionnaire. There's also a risk assessment nomogram online. And Paul and I tested it, and we found out that it didn't make any sense whatsoever. None whatsoever. I mean, you could have every lymph node removed and it didn't increase your risk of having lymphedema. You were at 89% no matter what. But this one is from Dr. Pillar out of Australia. This man is just crazy about lymphedema. He's done a huge amount of research. Those videos that you've seen are coming out of his department. This is a very, very legitimate source of a doctor who takes it's a teaching hospital. They take a whole lot of time and a lot of people to do this. So when you have time, you could take a look at this risk assessment and see what it says to you. Let's go on. Create your action plan. If you are someone who is at risk of having lymphedema, you are going to look at the factors that have been presented. You're going to look at the materials that are out there, and you're going to say, okay, so what do I do now? Well, self-education, coming to something like this, is an extremely important part of preventing lymphedema. I cannot tell you the vast majority of the people that I treated said, well, I didn't know if I burnt my finger that I could get lymphedema. I didn't know if I was in a car driving. I heard about airplanes, but I was driving in a car for 8 hours. I don't know why that I developed lymphedema. I didn't know that a cat scratch needed to have something done to it. Getting self-educated is your number one core things. You also have a great little brochure with you. And if you open it up, there is a chart. And if I was doing this with patients, I would stop this lecture and I would give everybody a tape measure. And then I would have everybody measure their right and their left arm. And then I would have it dated, and I would sign off on it as the therapist. But in this case, you're going to measure your right and your left arm at the points I've told you. You're going to write down the date that you did it. You're going to keep the tape measure because you want to keep that one to do it again. The other thing I want you to add to it is I want you to write down your weight. I don't care if you do it in code, but write down your weight. Okay, I have this secret code, so my husband doesn't know how much I weigh. He still thinks I weigh 130. We don't discuss it. These monthly measurements that you have in there, you don't have to do it every month if you don't want to. You could do it every 2 months, every 3 months. But you could throw this in a drawer that you're going to see it and then occasionally pick up that tape measure and measure it. The big clue is if any point of the arm is 2 centimeters, 3/4 of an inch larger than what it was at your base measurement. Now you're not running to the emergency room. You are calling your doctor. But first you're going to step on the scales and see if you gained weight. If you've got an extra 20 pounds on, that's about 3/4 of an inch bigger. It gives you an awareness, but it gives you documentation when you go to your doctor. Because if you go to your doctor and you do what I tell you to do with observing, and you walk in and say, you know, I've been watching my arm, and this one is getting bigger. He's going to say, well, how much bigger? You need to have a baseline measurement and to check it occasionally, so when you go to the doctor, you can say, I've been measuring my arm, and it's up at this point 2 centimeters. It's up 4 centimeters. You need to put your weight down on there so that you could document it wasn't weight gain that caused you in one arm, because I was told this. I was told that right here, this swelling, that was because I had gained weight. Now, I gained 3 pounds, but it all went to this arm and this part. That was what my doctor told me, okay? It doesn't work that way. Self-observations. This is what you do. Lymphedema loves certain areas of our body. So, you look at your knuckles. Lymphedema likes to start off right in here. So you compare your knuckles and say, do they look about the same? Yes, they do. Okay, good. You look in a mirror. You look at your elbows. Lymphedema also likes to hit right around here, create a little puffiness in here or here. Do they look about the same? Then you look at your arms and you say, Do the contourings look the same? When I turn it over this way, you look at the back of the hand, you look at your whole arm. If you look at my arm, I'm sure some people cannot see it, but you will see that there is a hump right here. This is the lymphedema in my arm. If you measure me right at this point, as opposed to this point, this is 2 centimeters larger. So that little hump is not very big, but it does increase the girth that much. This little, just being aware of it. I'm not telling you to set an alarm clock. I'm telling you to just, now you know it. You're going to notice it. Do I see this swelling? If you see that swelling, you go back, you get your tape measure. You see, is it true or not? Am I just freaking out? If it's there, you contact your doctor. They're going to refer you to a physical or an occupational therapist who's going to intervene right away. The sooner you get intervention, the better your quality of life is going to be. I don't have a compression garment on my arm. I don't need to wear one because I can control it by doing self-massage and wearing a nighttime garment. If I had let this get really, really out of hand, I would have to be wearing compression garments during the day. I would have a much more complex problem and I wouldn't have a resolution that's so good. So early intervention really dictates how much work you're going to have to put in every day the rest of your life. Am I doing okay on time, Paul? The endless list. This is my favorite part. What you should do to prevent lymphedema, i.e., that makes you feel guilty if you do develop swelling. Why they say what they say. There is lists out there. You can't carry a purse. You can't do this. You can't do this. You can't do that. You can't go here. You can't have a cat in the house. You can no longer have dogs. You can't be around a chicken. All sorts of things. But let's go through some of them and see if you've learned anything, okay? So it says take care of your skin. This little video shows you a crusty old dried up skin. When the skin is crusty like that, it leaves little openings between the cells so the bacteria can get in. Paul, run it again. You see how those little openings are? And bacteria can get in. But when your skin is smooth and moist, the bacteria cannot enter between the cell junctions. That's why we say use moisturizers and keep your skin in good health, because it's really your raincoat. It's what protects your body from letting bacteria get in. Avoid bug bites. Look what this nasty mosquito's going to do. He's going to land there, right? He's going to go right through that skin and drop in a whole bunch of venom. Your body's going to react by sending down white blood cells. Anytime you make your body respond to a problem, it sends in fluid. It sends in white blood cells. Your body is compromised. You don't want to send any more fluid to deal with. You want to keep it as fluid-free as possible. This is a sunburn. What happens with a sunburn is now you have caused a reaction. The white blood cells are moving in like crazy. Bacteria can get through the skin as it peels, and you can get swelling, and your body responds to it. Avoid heat. This means hot tubs, heating pads. I had one lady who told me that she had no problem with her arm whatsoever. She had a hot tub. But she made it real clear to me that what she does, she gets in a hot tub and she leaves her arm out. Well, this is a good thought, except the arm is connected to the trunk. So if this arm is at risk, this quadrant of my body and my back is at risk. We're divided up into little quarters. The head goes in half. The upper is divided down the center and across the waist. This is divided here. So those axillary nodes, that fluid from the front of your chest, from your back, all drain to these axillary nodes. So if you put the back in the front end, could you get lymphedema? Yes. But also when you raise your whole body temperature, your body reacts, even if the arm is out. So hot tubs, have I ever gone in a hot tub? You bet. But I do test it and make sure it's not really, really hot, and I certainly don't stay in there very long. Did I try it? Yeah, because I wanted to see what would happen to me. Okay, so you try it. You have to wait 24 hours to see the reaction. It's not going to be within an hour. Check it in 24 hours. See how your body handled it. Whatever you try, check it 24 hours later. Your body will tell you if this is something you can do or you cannot do. Avoid scratches, cuts, and needles. Obviously, anytime that you have a cut, bacteria sitting on your skin, the bacteria is going to run in as fast as it can, get into the interstitial space, and you have your white blood cells. Don't you love these little videos? Yeah. They're really kind of nice. Avoid trauma. This means blood pressure, cuffs, tight clothes, purse, shoulder straps, tight bras, tight jewelry. You can see that ring is just a little too tight. It went on and probably fit, and then she ate salt or she gardened or something, and that finger started to swell. And there was enough constriction at that point that that fluid couldn't get out of there, so then she needed to go to the hospital and have the ring removed. We talk about purses. I always carry my purse on my arm. I'm not supposed to carry my purse on my arm, am I? Because it constricts it here. So I'm supposed to carry it over here, which I try and do. Sometimes I forget. But I also keep my purse as light as I can. If I have a big old heavy purse on this side and this arm is being used to balance it off, I'm still stressing out these muscles and causing an imbalance to the other side. So keep the purse loads down. My favorite was the lady who I told, don't carry your purse on your shoulder, and she walked in with her purse right here. There's no constriction in any area of your quadrant, bra straps, shoulder straps, those types of things. You can pad them off. You can get bra straps that are wider, or you can buy little attachments to put on there. I mean, I'm not asking you to go out and get a 4x4 and put it on there. It's, just a little padding when you're buying a bra. Tight clothes. Yeah, as soon as you bend, they get tight. They constrict at the tight points. You're going to swell below it. That's the thing to it. Here's my favorite thing. I am right now giving you an excuse never to wash your walls again. Vacuuming with that arm is not a good thing unless it's self-propelled. You're using your shoulder, you're using your whole hand, and you're gripping the handle. If you want to use it as an excuse, that's up to you. I just gave it to you. Again, you could try vacuuming, and if it doesn't affect you, that's fine. I've got my husband to do it, and he does a pretty good job. Washing walls. I had quite a few people who came in who did activities when it came to spring that they didn't do the rest of the time. This is you dragon boat ladies. You build up to an activity, and you do that activity on a regular basis so that your body adjusts to it, has the muscle strength to do it, and then you can continue doing it. If you golf, you don't start with, 16 holes? 18 holes? They got a couple extra ones I don't know about. Okay. I did have a guy who golfed. I told him, just go out, hit some balls, but do 10, 15 minutes worth, then build up again. And then we'll go to the golf course and I'll watch you and look at your body mechanics and see what you're doing. And over time, he did build back up to that activity and he didn't get swelling. Where you have other people who decide it's spring, I have to wash the wall. Like this. And while I was washing the wall, it wasn't an exercise. It is an exercise. So you can get out of wall washing too. Okay? Air travel risks. We're almost done. Air travel risks. I love this one. It's my very, very favorite one. Cabin pressure. Up to 10,000 feet, it is pressurized. There is a differential in pressure. Yes, it does have some effect on you. Everybody who gets in an airplane does swell a bit. that cabin pressure, yes, they have proven it has a mild impact, okay? Pulling, lifting luggage. This is where I run into trouble. It isn't anything to do with the air pressure, is it? You go to the airport, you've got your bag, you've filled your bag, you take it to the airport, you lift it, you put it in your car, you park your car, you pull it out of the car, you drag it through, you get your ticket, you lift it up to weigh it, you check it in. And then you take your little carry-on tote and you throw it back on that's got the 25 pounds of stuff that you didn't get in your bag. And you carry it through security and you walk carrying this bag. That is more stressful than the average pressure change. It really is. Look at your suitcase. Are you pulling it this way? Are you pulling it this way? Do you have one that you just walk alongside? I have yet to find one that doesn't affect me. It doesn't matter which arm I use. Every single trip I go on, when I go home, I have to do a lot more MLD because I always swell. It is, Paul picks up my suitcase all the time. Everybody who travels with me has to pick up my suitcase for me. But I still do it. Immobility. Sit somewhere, anywhere, for 4.5 hours and see if your feet don't swell. You're not using your muscles. If you fly Southwest like I do, you sit like this. You've got the lymph nodes closed off so that fluid can't possibly go through them. These are closed off. You certainly aren't breathing like this. You're breathing how much longer? You're not using your part of your body to make the lymph fluid move. Your venous system isn't working as well either. It's because your feet are hanging down. You're not moving. You need that muscle movement. You know, they switched out peanuts on planes for people with peanut allergy, and so they brought on salty pretzels. Right? And then, of course, what do I order? Tomato juice. And I wonder why when I get off the plane and I walk to the baggage that my feet hurt so bad. Getting bumped or shoved. The worst injuries that I've ever had have been in an airport. I literally had to have surgery on my shoulder once because somebody was in a hurry and they hit me so hard that I fell and I hurt my shoulder. I've been hit and hurt my hip. Now I used to travel 30 weeks out of the year. But getting bumped or shoved, you have to be careful because people don't see you anymore. You have become invisible. Unless you're 22 and you got a miniskirt on and high heels, you're invisible. People don't see you. They want on the plane. They're hurrying to get to the cow line. And even in the cow line, you know, does everybody know the cow line from Southwest? So, you know, they have the numbers backwards. It doesn't say 20 to 26 if you look at it. It says 26 to 20. And there's always someone who goes up to it and tries to get 26 before 20. And then there's this shuffling. But you're all jammed in this little tiny line. Stress is when you tighten your muscles and you don't move. You don't breathe. Airplane travel, this is how come the research is not definitive. Is it the air pressure in the plane? One study says yes, one study says no. I do think it does have an effect on you. But you should be wearing a lightweight compression garment when you're on the plane for lots of other reasons besides the pressure. You should be making sure when you get on the plane that you are carrying a paperback book. You're not carrying all the leftover stuff that you have. You get there an hour and a half early so you can meander to the gate. If somebody wants to rush by you, be aware and just let them go. Take your time. You know you got an hour and a half to get to the gate. Just relax about it. Today, hopefully what you can say that you have learned is some basic lymphatic anatomy and physiology. You've learned where that lymphatic system is, it runs parallel to the veins. You've learned a little bit about the physiology on how it picks up bacteria and cellular waste in your body and takes it away. You've also learned that how the basic lymphatics function. They start with the collagen fibers, pulling open the initial lymphatics. It's a negative environment. Swelling is positive, and it sucks it in. And then you see the vessels pumping, and then it moves to the nodes where it is filtrated and continues on. The definition and the causes of lymphedema, some are really, really basic. Some are tweaking it to have you look at lymphedema a little bit different way. But it is definitely a swelling that is an accumulation in your skin or in your body that is caused by an impairment or lack of a collateral lymphatic system. You've learned about those risk factors, assessment, and research. You've learned that research it's not God-written, okay? You have to read it. And then if you can't see that there's proof in that article to back up what they're saying, or you can't make sense of the numbers, don't believe it. They'll have some more research in 4 more days. Understanding preventative measures. Hopefully you understand that your skin is the protection for your body, and keeping that skin healthy is key to keeping the bacteria getting in or your body happening to react to an injury or a wound. And you need to create your own lymphedema awareness plan, which means you're going to take that brochure and you're going to find some time at home in the next week to measure your right and your left arm. And then you're going to put that in a drawer or someplace that you periodically look at. I had one little lady who put it as a magnet up on her refrigerator. I said, too much. You don't want to think about lymphedema every day. How about you put it someplace where you get to look at it once a month? Put it in with your bills that you pull out once a month to pay, your stamps. You know, do something. Don't let this scare you too much. But you do want to be able to occasionally look at your hands and say, yeah, I know if I see that swelling, that's important for me to take care of. Okay? So, any questions, any concerns? Yes.
What are the landmarks? In the brochure it says the landmarks for forearms.
The landmarks are going to be what you determine on your arm. So on my arm, a landmark would be, I would take the tape measure and I would decide if I'm going to measure around my wrist, over the bone, in front of the bone, or just behind it. You have to decide which one you're going to do, because if you measure here and then later on you measure here, there's a couple centimeters difference. You're going to pick a friendly mole, or you're going to take a rubber band like this, a little rubber band here, and you're going to measure between it and write the distance down. And then that's where you're measuring that mid-arm point. For the elbow, it's the crease. What you have to keep in mind, are you measuring with your arm perfectly straight, or are you measuring with your arm bent? So you need to make that decision. The same thing in the upper arm, it's approximately halfway between your elbow and your armpit. You're going to make a little mark, and you're going to say that's where you're going to measure every time. To measure the top of your arm, you're best to take a tape measure, bring your arm straight down to your body, take it there, and just then look at it. If you move your arm, do you have a tape measure, Paul? You got one. Oh, it's right here. So let me show you a demonstration with tape measures. Come on, Paul, jump up here. Okay. So if I take Paul's arm and I hold it like this, and I measure the length of his arm to here, okay? And I bring it straight down. Do you see how much it gaps? That's the change of a bend of an arm. I bent him at the shoulder, but you could do the same thing at the bottom. We are out of time, aren't we? We have one more question.
You talked about catch, scratch, and needle.
Yeah.
How about acupuncture?
Any acupuncture?
Acupuncture.
I just was talking with the doctor who said, you know what, everybody's worried about acupuncture, everybody's worried about needle injections from a doctor's office, but the one thing is, they always clean that off, and with a needle they put it in, and then afterwards they put a Band-Aid on it. I've had acupuncture on my arm. I've not reacted, but let's put it this way. If someone's doing acupuncture on my arm and I told them I had lymphedema, I would hope that they would be smart enough to try 1 or 2 and then take them out and say, come back and see me in 24 hours. I want to see how your arm reacts. Okay, thank you very much. I'm sorry that I kind of ran a
I'll
little
be out in the
long.
hallway. If anyone wants this emailed to them, just let me know your